can proceed in managing the crisis itself psychologically. So together with a team of two ladies and myself, we came up with the initiative to reach out to Cameroonians, to Africans far and wide about the impact, the psychological impact of COVID-19 in our time. You know, there's a lot going on, financial impact and well health impact. Everything is going, but yeah, little is being spoken about its psychological impact. So that's what we're going to be looking at today. We thank you all for taking our time to be here. Despite your busy schedules, we hope that you will leave this presentation or this workshop empowered. We hope that you'll be able to also educate other persons in your community about COVID-19 and its psychological impact. That's just the essence of this presentation. So for this presentation, we are going to adopt this outline. So an overview, epidemiology and the current burden of COVID-19 is going to be elaborated by myself. Mental effects, the mental health effects and its consequences of COVID-19. That is going to be handled by Dr. Bonhida Take. And then we're going to look at coping strategies for these mental health effects and consequences. This part is going to be handled by our mental health expert, Ms. Epiphany Fosso. So before we proceed, I would like to lay down some ground rules for effective presentation. You know, unlike other presentations, we are doing this online. So first thing, when you got into the forum, you notice that you were automatically muted. That is to make sure that we don't interfere with the presentation while it's going on. So after going through this introductory phase, we are going to mute everyone except the presenter. So keep your mics muted so that your background noise doesn't get into the presentation. Secondly, while the presentation is going on, if you have a question that pops up, you can't interrupt the presentation, but what you can do is to look down at the control panel and look at the chats. You drop your question in the chat. We're going to review all the questions in the chat section during the Q&A session. Now, during the Q&A session, for you to be able to ask your question, still in the control panel of Zoom, you'll be able to lift up your hand. There's an option there to raise hand. So when you click on it, we'll see the person that's raised hand and we'll call the persons in turn. We're going to attend to the questions in the chat section as well as those who raise hands to ask their questions verbally. Now, feel free to close your camera if you're doing something else so that you don't distract any other participant or the other viewers. That's the first thing. And then please do not interrupt the presentation. So having laid down this rule, I would just want everybody to unmute the mic. If you've heard me so far, you just say, yes, we've heard you, and you can write on.
Yes, we've heard you. It's okay.
All right. So for this presentation, we are going to look at the overview and epidemiology of COVID-19. So that is going to be the first part of this presentation, and it's going to be taken care of by myself. Sintieh, I'm a medical doctor with the Cameroon Baptist Convention, presently working in Yaoundé, Cameroon's capital. I'm happy reaching out to you all during this very critical moment of our history on Earth. So we are going to look at what COVID-19 is all about, its epidemiology and its burden in particular, noting Africa in particular. So let's ride on. So what is COVID-19? What exactly is COVID-19? So in December of 2019, a cluster of what we call pneumonia cases were identified in Wuhan, China. Pneumonia is a respiratory tract infection. It's a lung infection. It's a lung disease. And so these cases were identified. And what was unique about it was that they were strange cases. So these cases were identified in Wuhan, and they said, to the best of their knowledge, it's the first time they're identifying such type of pneumonia. Right up to January of 2020, its cause was exactly unknown. Until then, we heard about the coronavirus. The coronavirus is a group of viruses which have a genetic material encoded by a crown. Now, crown in Latin stands for corona, and that is why its name, its term, the coronavirus, meaning the crown virus. Now, as of date, the exact etiology of coronavirus is unknown. But current scientific studies and hypotheses say that its origin might come from bats. So this is taken up from other coronaviruses that have existed in the past, notably the Middle East Respiratory Syndrome coronavirus, which occurred in 2012. And this was a very significant outbreak common in the Middle East. Also in 2002, we had the severe acute respiratory syndrome coronavirus 1, which occurred in China in 2002. This is actually 90% similar to the current coronavirus we have causing COVID-19. And that is why we have the coronavirus that is causing COVID-19 is termed the severe acute respiratory syndrome coronavirus type 2. Now, with ongoing studies, we find that some coronaviruses found in other reptiles have been identified and similar. And so science is capable of saying that the intermediate host, that means from its origin and to where it lays before getting to the human population, are pangolins and snakes. So the coronaviruses that has been identified in pangolins and snakes have been found out to be 70 to 90% similar to that which is causing COVID-19, and that is infecting the human population presently. So that is exactly what we are dealing with. Now, having said this, we know that all of these viruses have been existing in the animal population. How do these then get to our human population? It is a phenomenon referred to as the spillover. The spillover is either a genetic upgrade of the viruses that decide to move from the animal species to the human species, or because of human activity, we get exposed to these germs that are unique to the animal population. So there are over millions of bacteria and viruses that are existing in the human population. We would have heard about the bird flu, the avian flu, and so on and so forth. Those are germs that are unique to the animal population. But because of human activity, we are being exposed to these germs. And that is why as exploration continues, as science develops, we'll be facing more and more outbreaks. And that is why we are learning from this one so that we prepare the world for other outbreaks, since we can't stop exploring. Now, what is actually the epidemiology? What is actually the burden of COVID-19? We start with how it spread. So normally we know presently that it spreads through air droplets from an infected person, to someone who is not infected. So if someone who is infected is close range to you, the person coughs, and we have a trajectory, a ballistic trajectory that brings these droplets to another uninfected person. Now, that is the first pathway. It will travel through air to get there. Secondly, we also have a long-range transmission, which goes with aerosols. And this is seen that somebody would sneeze, and current study says that the viral particle stays in these droplets for up to 6 hours. So meaning that if somebody sneezes in a location and you get there 6 hours later, there is a chance that you might also pick it up if you are not protected. The next means of transmission is through contaminated surfaces, and we refer to that as the fomite route. So These contaminated surfaces, it's common. People who sneeze and touch the doorknobs, they will move from areas and contaminate the various places. And so what do you need to do? You need to be sure that you are washing your hands often. You're wearing a face mask so that you don't get contaminated. So we actually see that it's from its spread that these barrier measures have been proposed by the World Health bodies so that we are able to curb down the spread. Now, as long as we know that this is a method of spread, some scientists have been able to demonstrate that yes, this virus can be transmitted by a sexual with the lockdown, with the quarantine. There are some persons who stay at home. There are some persons who stay at home. There are some persons with the increased exposure. There is also transfer of promiscuity and so on and so forth. So bear in mind that safe sex is also encouraged during this period of time. Now, next we move into the presentation to look at who are those persons most at risk of having the virus. The first group of persons are animal workers. So we said that this virus exists in the animal population. It exists in the animal population. So the more persons working with animals are exposed to infected animals, they'll trap this disease and then they'll bring it to the human population. So they are the most exposed group. Next, we have health workers. These persons are exposed to persons who are sick. And so they need the protective equipment to prevent them from contaminating themselves and from transmitting it to their own families. We've recorded over 1,000 health workers who have died worldwide from the pandemic. Now, the next group of persons who are exposed to this virus are persons who take care of sick persons. So if you're taking care of someone who is sick, don't practice this. Put on your mask and protect yourself in as much as possible, because once that person coughs or sneezes, you're at high risk of getting this virus. Next, now we look at its symptoms. Throughout this time, we've spoken about the symptoms on every media. We've spoken about the symptoms on every media, but it's worth noting that the coronavirus type 2 causing COVID-19, it's the only coronavirus as of now that causes severe diseases. We've all had cough and catarrh in the past, and we know that it wanes out after 10 to 14 days without any treatment. But for some reason, this new coronavirus is capable of getting you to an intensive care unit. So you will present with a fever, a cough, shortness of breath. Some persons will have body ache. They will have a sore throat. Another person will have a running nose, just a normal catarrh. And in very severe cases, you find persons with loss of the sense of smell. You can't smell something. It's that bad. And in some cases, persons present in the hospital with diarrhea, and we treat them for other things and we forget that is COVID-19. I have been exposed to cases like that, and after doing their COVID-19 test, they turn out positive. So you see that we are frontliners and we learn from our experience. That is it. So the symptoms are so many. If you have symptoms that are suggestive, you get tested. We're going to get there. Now, looking at the burden of the disease, as of last night, we recorded over 8 million cases worldwide, with over 142 cases occurring in the last 24 hours. Presently, the world records over 450,000 deaths. Now, Africa is recording slightly over 200,000 cases, and with slightly over 4,500 cases of dead cases. So this is what happens. We are arriving a plateau phase of the coronavirus in other European countries. But in Africa, we are gradually having an increased number of cases. That is why we are actually doing this presentation, to make Africans know that, yeah, the coronavirus is real, and it's not only something that will affect the white population. Now, look at the case of Africa. We have South Africa recording already 83,000 cases, Nigeria 18,000, Ghana 12,000, Algeria 11,000, Cameroon is at 9,800 cases. These are the top 5 countries. And why is this happening? Why are the cases still climbing up while we're having a plateau in other areas? This is because in Africa, in Cameroon in particular, many of us don't even believe that the disease exists. Okay, many persons want to go to the isolation centers to to see the persons who are sick before they actually believe that it's real. Well, as a health personnel who has been in the front line, I'll tell you it's as real as this. It's as real as serious that we need to take care of ourselves to prevent us from being transmitted. Secondly, we need more than just talking. We need to take action. This is one way of acting to empower people psychologically so that we are more knowledgeable and we're able to break down the spread of the virus. So that is the case of Africa. Until we believe that the disease exists and we practice the barrier measures of wearing face masks always, of maintaining social distances, of hand washing, it's going to keep increasing. That is why the World Health bodies will say that they hypothesize that Africa might have the largest, the heaviest burden because we are not practicing these measures. Now, I won't end my part of the presentation without talking about the myths surrounding coronavirus. So what are the current myths? Presently, we wear shoes and walk around, and many persons think that the shoes can transmit COVID-19. As of date, there is no evidence for that. But you have to be safe. You have to be preventive in order to be safe. So if you wear your shoes, you go out for work. When you come back at home, please keep the shoes outside. Put on your gloves, wash them, and dry them off. Don't get them into the house so that there's no chance that you carry any other bacteria, any virus or a bacteria into your home. Secondly, persons think that wearing face masks for long will actually increase carbon monoxide in their system or carbon dioxide in their system. Well, that is false. The face masks are thin clothing and you can breathe through. It doesn't even affect the quantity of oxygen that you need in your body. But of note, do not wear face masks for sports. This is discouraged. This is not good because definitely you need more oxygen for exercise. And doing that, you're going to be suffocating yourself if you do that wearing a face mask. Secondly, the face mask is going to get wet. And when it gets wet, it's more a risk to you than protecting you. It's going to transmit the viruses to you easily because if there have been droplets there and it gets wet, it's easier to get into your mucosal membranes. So do not wear face masks while doing sports. Wear face masks while going about your normal activities and do not be afraid that is going to reduce the oxygen in your blood. Next, some persons think that alcohol in itself can kill the coronavirus. Well, it's a big no. It's a big no to all this because alcohol in itself will bring down your immune system and it's also going to predispose you to more severe forms of the coronavirus. We move next to the most common and most overheard myth, which is that the network 5G it's killing or it's what is killing and not coronavirus or it's what is transmitting the coronavirus. And return back to our basic sciences where we look at the visible light and the radio waves. I want to elaborate on the fact that the 5G is a form of radio wave and it's even less harmful compared to visible light that allows us to see. So yes, it's there and it has its own role in communication, but it's not the reason for the propagation of the virus. That is the first thing. The virus is an independent entity to 5G. Now we are in Africa and we have an enormous pharmacopoeia in Africa, and spotlighted has been ginger, garlic, and a mixture with honey, which have been said to treat COVID-19. Well, friends, I'll tell you today that these aren't the treatment for COVID-19. As of date, there's no treatment for COVID-19, but they are supportive treatment. They dry off the airway. They help you feel some relief. Same thing you would do when you have a cold, because all of us have been having catarrh and cough in the past, and you used to take cough syrup and so on and so forth for that, and it dries off these symptoms in no time. So that is what happens. But ginger and garlic, don't get yourself intoxicated with them because it won't cure you from coronavirus. Next is the fact that persons keep saying that there is a drug, there is a cure for COVID-19. As of date, there is no cure, there is no drug. Last week, a release was made that dexamethasone improves outcome of patients who are on assisted respiration who are in the ICU. It's not also a cure. It's just something that helps to improve the outcome. Now, you will ask the question that why is it that we have this number of cases getting recovered when we have no cure? Look at the same scenario. You always had a cough and a catarrh in the past, and you will not need a treatment to get healed. After 10 to 14 days, it will disappear. So 50 to 60% of persons who are infected with this virus would heal spontaneously. It is a gift from Mother Nature, and it's a gift to our immune system. If you fall in the other 40% who have severe cases, you'll be hospitalized, and some persons will recover spontaneously. Out of the 40% that are hospitalized, another small percentage of 20 to 30% will need oxygen that are going to be placed in an ICU. And that is the progression of COVID-19. Ladies and gentlemen, we've come to the end of my part of the presentation. Hope it was elaborate enough to enlighten you on what COVID-19 actually is. At this juncture, I'm going to stop my screen share, and we're going to be handing the screen share to the next speaker, who is the person of Dr. Brunhilde Take. We welcome all those who are joining us late, and we hope that you're going to pick up from this section. Here, we're going to be talking about the mental health effects and consequences of COVID-19. So you're all welcome to the second part of the presentation. And if you're joining, sit tight, you haven't missed much. Thank you. Dr. Bonhida, are you there with me?
Hello, everyone. Thank you for joining us on today's session of our presentation entitled COVID-19 and Mental Health. I'll be taking us through the consequences and the effects of COVID-19 on our mental health. Before I begin, can everybody see my screen?
Yes,
Please,
5 on
if you
5, I can
can, I
see your
just
screen.
need a wave of your hand. All right,
Yeah.
thank you very much. So I am Dr. Brunhilde Tifuh, currently working at Mbopi Baptist Hospital, Douala. For this presentation, we would adopt this outline. Beginning from an introduction, we would define a few terms, then to the effects of mental health on both adults and children, and lastly, on the consequences of COVID-19 on our mental health. We've been hearing mental health, but what exactly is mental health, or what do we define as mental health? So we are going to use the definition according to WHO, which defines mental health as a state of well-being in which an individual realizes his or her own capabilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. There are three components of mental health: emotional well-being, which includes happiness, interest in life, and satisfaction; psychological well-being, it includes liking most parts of one's own personality, being good at managing the responsibilities of daily life, having good relationships with others, and being satisfied with one's own life. Social well-being refers to positive functioning and involves having to contribute to society, social integration, social actualization, and social coherence. There are a variety of mental health disorders and their presentations intersect. By intersect, we mean some of these conditions may have similar symptoms. You would agree with me that once you hear that somebody is mentally ill, the first thing that comes to your head is either the person is walking naked in the streets, or the person is being very aggressive, or the person is talking to him or herself. However, all of these mental disorders are characterized by abnormal thoughts, perceptions, emotions, behaviors, and relationships with others. They include, but are not limited to, anxiety, depression, substance abuse, obsessive compulsive disorder, post-traumatic stress disorder, psychosis, schizophrenia, and personality disorder. The current crisis has greatly affected the world. The effects of this pandemic is not only limited to our physical health or to the economy of our nations, but more and more people are affected globally. From policymakers right down to children, all of us are affected. And some people may not even realize that they have a problem. There is a lot of fear, worry, and uncertainty, and mental health experts believe that our mental health will not be the same again, because the impacts of the COVID-19 pandemic may linger even after we think that it has finished or it's done. Some persons have higher degrees of mental distress, such as healthcare workers. These people face a lot of hardships during this pandemic. They work in extraordinary circumstances. They are more likely to feel under pressure, stressed, worried about transmitting the infection to their family members or to their loved ones. Older adults who are probably in isolation or who have cognitive decline may become more and more anxious, withdrawn, angry, and stressed. Children as well may feel sad and be very, very afraid. In people with pre-existing mental disorders, symptoms may worsen with the crisis. For the purpose of this presentation, we would like to define effect as a change that an event causes in somebody or something, and consequence as the result of an action, most in this case a bad result. Moving on to the effects of COVID-19 on our mental health, the first effect we'll be talking about is isolation. Because of the pandemic, people are isolated, either because it's one of the measures to prevent the spread of the disease. If you're tested positive, you're put in quarantine, or because of the lockdown measures, you are in your own house, you don't go out, you don't meet with your neighbors, you are kind of isolated from the rest of the world. Those in isolation centers or in quarantine centers don't have their loved ones to take care of them. The loneliness all leads to increased risk of depression. It lowers their self-esteem and it makes them anxious. People fear there's increased risk of suicide when somebody is very lonely, and they fear being stigmatized by others by the time they get well from the COVID-19, or even probably talking to people. They'll be afraid that if I talk, maybe the person is feeling I want to infect them. And that takes us to the next effect, which is anxiety. Anxiety due to fear of being infected, anxiety due to fear of dying, anxiety due to fear if the society would accept us back normally and not judge us, or anxiety because we are probably embarrassed that we have caught the infection. A survey was conducted among people in the Asia Pacific region, and at least 30% of the respondents in this survey agreed to anxiety during this pandemic. However, the level of anxiety depends on the area we find ourselves in. I'll take, for example, the case of Cameroon. The two most affected cities are Douala and Yaoundé. The people who live in these cities will be more anxious compared to somebody who lives in probably Kumba, where we have just about 10 cases, and they probably don't even believe that the coronavirus actually exists. We now move to the next effect, which is depressive symptoms. People are developing depressive symptoms like sadness, feeling of hopelessness. People are helpless. They are losing interest in their environment. Because of the uncertainty, some people begin to feel like they are living in a black hole. The depressive symptoms are as a result of the circumstances surrounding us. Every day you wake up to news of thousands of people getting infected, thousands of people dying. All of this has a way that it plays on our mental health. To the next effect, sleep disorders. People are finding it difficult to sleep because they fear getting infected. As usual, they fear dying due to COVID-19 infection. Parents, for example, cannot sleep because they worry about their children, they worry about themselves, they worry about their children. Anxiety and depression will lead to sleep disorders. Essential workers, especially those in the healthcare sector, may also experience sleep disorders. Moving on to the next effect, feelings of exclusion. People are feeling ostracized from their friends, from their family, from their neighbors. Others feel that no one is checking on them. Healthcare workers may also feel excluded because their family or neighbors would make them feel that they are the ones carrying the coronavirus to come and infect them. And now, when you can't sleep, when you feel excluded, when you are sad, when you are hopeless, the body finds a way to adapt. For some, they become addicted to their phones. They are overly concerned about social media, and they have an uncontrollable urge to always log on to the various platforms, spending many hours of their day on social media, and this impairs other activities of their lives. There is a quote by Barad 9 which says social media is like suicide in daily installments. In the same light as people find solace in social media, others are finding solace in alcohol, in drugs. We have heard of people like the presentation by Dr. Sintieh. He mentioned that people have this myth that if they drink alcohol, it kills the virus in their system. So you can see that this is an effect of this pandemic on our mental health on some people. Others will tend to drug overdose. We heard that chloroquine will help us to prevent coronavirus, and just a couple of weeks after, we started seeing news of people having chloroquine intoxication. The next effect we'll be talking about is potential exposure to domestic violence. With the lockdown measures, people are locked up in their houses, and as such, there's always an increased risk of people being violated at home. The next we'll be talking about is bereavement or abnormal grief. People have lost their loved ones or family members due to COVID-19 infection, and they've not been able to see their remains before they are being buried. Not being able to mourn our loved ones or family members in a culturally acceptable way has a very significant impact on our mental health. On to the last effect of this presentation, the effect of COVID-19 on our mental health: disruption of leisure activities. People have been unable to do the things that they usually do, especially the outdoor activities. For example, there are people who planned vacations for this year. There are people who planned to tour the world this year, but now they've been unable to do so because of the ongoing pandemic. There's travel restriction, you cannot go anywhere. We wake up now to people celebrating birthdays on Zoom. We have people who are celebrating, who have online dinners. We are adapting to a new way of having our leisure activities out of the normal that we had expected. Just as adults are affected mentally, as we had earlier mentioned, children as well are affected. Children are anxious about the pandemic. They are sad, they tend to worry because they can barely even fully understand what this whole pandemic is all about. They tend to have sleep problems, they cry excessively. In the past 3 months, children have not been able to go to school. For those whose parents are well-to-do, who have probably put them, what they are going through online classes, but the majority have not been able to go to school. So imagine 3 months in the house of doing nothing. A child's development is going to decrease, the intellectual development, and there's also an increased potential for child abuse or neglect during this pandemic. We now move on to the consequences of mental health of COVID-19 on our mental health. As we had earlier defined, consequence is a negative result. So we have this list: residual stress, obsessive compulsive disorder, psychosomatic disorder, post-traumatic stress disorder, suicide, increased pressures, be it financial or education, difficulty re-engaging with changes caused by the pandemic, relapse in patients with pre-existing mental conditions, sleep disorder, depression, and anxiety. So we are going to throw more light on the first 5 consequences of COVID-19 on our mental health. After 6 months into the pandemic, there's still a lot of uncertainty. There's still a lot of fear. People are adapting to a new way of work. Before, to go to work, you have to leave your house, meet your colleagues, you share a table or you share an office. But now you're in front of you have your table alone in your house, you have just your laptop, and you're talking to people virtually. People are adapting to a new way of work, to a new way of studying. This causes a lot of stress on some individuals, which may be overwhelming, consequently leading to other health conditions. Even more worrisome is the fact that experts say the pandemic will come in phases, and this is just phase one of the pandemic. Who knows what the rest of the phases will look like? Moving on to the next consequence of COVID-19 on our mental health, obsessive compulsive disorder. With the constant news of the possibility of the virus staying active on inanimate surfaces, like Dr. Sintieh mentioned, one of the means of transmission is, he said, fomite something, I cannot really remember. Many people are developing obsessions and abnormal behaviors with respect to the safety measures that have been put in place. This disorder may be new, or it may be heightened in people who already had a pre-existing obsessive compulsive disorder. These people usually are afraid of contamination, and as such, you find them practicing very frequent hand washing and even bathing, frequent use of hand sanitizers. They struggle with perfectionism. However, no one can perfectly protect themselves from COVID-19. They also struggle with thoughts of harming others. In this case, they fear that they may infect others. This is a mental disorder. Moving on to the next main consequence of COVID-19 on our mental health, we have psychosomatic disorder. The human mind is like a software and our body is a hardware. The mind gives commands to the body. So to say, anything the mind thinks, the body manifests. That's why you find people developing sore throat, cough, difficulty in breathing, just by hearing that one of the people they had come in contact with is a suspected case. So you can imagine what our mind can cause us to do. Moving on to the next consequence, we have post-traumatic stress disorder. It occurs after a traumatic event such as this COVID-19 pandemic. The psychological trauma causes these people to have constant flashbacks, nightmares, negative thoughts and feelings about themselves. And they also have outbursts of anger. These people even go to the extent of not wanting to interact with people, they avoid activities. They just want to be on their own. And to the last consequence of COVID-19 on our mental health is suicide. A study in New Delhi in India reported 300 deaths due to suicide as a result of the lockdown. This number, however, is an underestimate, meaning more and more people are killing themselves. Why? Probably because they are afraid of getting infected or from the loneliness. Remember, I mentioned that loneliness can increase the risk of suicide. Depression can increase the risk of suicide. Another reason why people are killing themselves may be from alcohol or drug withdrawal. I mentioned that there were reports of chloroquine toxicity. People are dying. You hear that this drug is working and you go and take an overdose because you want to overprotect yourself and you end up dying. So at this juncture, ladies and gentlemen, thank you all for listening. We have come to the end of this presentation, and I'll be handing over to Miss Epiphany Fosso. Thank you very much for listening.
Thank you, Dr. Brunhilda, for that elaborate presentation. Uh, Up next, we're going to be having our third speaker, who is actually our mental health expert on the panel, Miss Fosso Epiphany. She's going to be giving us details on the coping strategies with respect to COVID-19. So this is actually part of the most important part also for the presentation. And if you're just joining in now, do not feel bad that you are joining in when the third speaker is talking, but actually you're coming in at the right time. So kudos to Dr. Brunhilda for that presentation. Miss Epiphany, are you there?
Hello, are you getting me?
Getting you 5 on 5.
I
You have,
hope you'll see my screen.
yeah, it's perfect.
Okay, welcome to everyone. Good evening, everyone. I'm Fosso Epiphany, psychiatric and mental health nurse. So we'll be talking on the coping strategies. So first and foremost, what we need to know is that in every problem solving, the first step is to identify the problem. And I want to believe that with the previous presentations, everybody was able to identify one or two problems. So I hope in my own presentations, we are going to identify solutions. So how to cope with COVID. The very important thing is to learn about the symptoms of COVID. Knowledge is power. When you master the symptoms of COVID, it's going to prevent you from panicking for no reason or from being so anxious. So it's very, very important to learn about the symptoms of COVID, because we know even before we start talking of COVID with the symptoms of catarrh, cough, sore throat, all those conditions were existing before. So when you have all the basic informations about COVID, it really help in allaying your anxiety. And the next thing we need to do is to avoid watching or reading, listening, or avoid watching, reading, listening news that makes us anxious or depressed. People react differently from situations. That is, an information may be distressing to me, but it's very okay to another person. Once you identify that you are not able to cope with something, it's better you just avoid doing it, like watching certain type of information or watching news from some channels. So there was a time a colleague was just sharing to me that each time I open this particular channel, in fact, I'm not going to name it here, it's just as if I should just choose a gentle way to die than to allow COVID to kill me. It's true, some channels may actually be relaying a true information, but the way they used to relay it may be very distressful. And also we need to seek information from validated sources, because the harm of fake news is really, really, in fact, it can really be detrimental to our mental health. So to protect your mental health, it's better you seek information from validated sources. And then we'll need to share only accurate and validated information about COVID-19. We said already in the previous slides that some informations can really be distressful. In as much as you want to avoid the distress, you should not also be the cause of distress in another person. So for that reason, you really need to mind what you are sharing with others. And now, nobody was expecting COVID. COVID came, but we need to continue living. But how are we going to do it? For anything we are doing, we always need to ask ourselves, is it safe? Am I going to expose myself? Am I exposing others? So we need to adapt new routines. We must live our life, but there are things we need to change the way we were doing them, and we need to drop certain things we were doing, and then we need to start doing new things. So we need to adapt new routines to suit the situation, the current situation. And at times we may just feel so overwhelmed, just so distressed. There are things we can do to help ourselves. We can take a deep breath exercise, we can stretch, we can meditate. We are not really going to expatiate on that in this presentation, but I can encourage everybody to go on YouTube and to download videos on deep breathing exercises or deep muscle relaxation exercises. I can reassure you that it actually works. It works. Though at times some clients will tell you, I think these things works only for white people, really. It may be funny, but actually it works. Just download, you follow the instructions, you just imagine that you were having a therapist in front of you, and then you try it, you see. And now we're going to talk about trying to eat a balanced meal. It is very important. it is important for us to really eat balanced meal. Okay, now we are saying try to eat a balanced meal because we know food is actually a luxury in some parts of our country and even in Africa, even in other places out of Africa. So, and we also know that some people get more anxious when the symptoms of the COVID are more severe, and we know the place of food diet in our immunity. So it is very important to eat balanced diet to be strong. Yes, so that at least our immune system, to boost our immune system, so that the immune system will be able to fight the disease. Yes, when we have a very strong immune system, our symptoms will be lesser. And also, some foods, like some fruits, even like banana, they have this property to elevate our mood. Yes, some people think they act as antidepressants, so they can actually help us when we are really anxious. And the exercises, it is very, very important for us to continue exercising in this period. One, when you exercise, it improves good sleep. Yes, when you exercise in the night, I really doubt if you will have insomnia because your body will actually recognize that need to rest. Exercise helps you to exercise helps you to relax your brain. It helps you to bring out this negative energy. Exercise helps you to maintain a healthy weight. And then we know the relationship between obesity and low self-esteem and depression. Yes, so because of all that, we really need to continue exercising. But when we are now engaging in exercising, we always need to ask ourselves the question: as I'm engaging myself in this particular exercise, is it safe for me? Am I exposing myself? Am I exposing others? In the image, we are seeing a lady exercising alone. I don't think there is any need for her to get infected. And we also need to get plenty of sleep to maintain a good mental health. It is very important. So let me just name some few tips for us to get a good sleep. So to maintain a good sleeping hygiene, yes, we'll encourage that in the evening you get a warm bath. You don't sleep with an empty stomach. In as much as we encourage people not to eat heavily in the evening, but it is also not advisable for you to sleep with an empty stomach. I don't know how many people have ever tried the experience to sleep hungry. I don't think it's very sweet. At least you just have only shallow sleep. If personally have tried it, but the sleep was not really nice. And you sleep in a comfortable bed, well-made bed with clean linen. You put on appropriate dresses. That is, you won't put on very tight dresses, tight jeans, a belt that will be pricking you, and then you don't sleep with bright light. And it's better you avoid noise. If you can switch off the TV, switch off the radio. Though for some people they will say they like sleeping with some type of music, but it's actually not really advisable. Yes, so those are some of the things you are encouraged to do to improve on your sleep. And there are some things you need to avoid, and this will take us to our next slide. So you need to avoid alcohol and drugs. Some people actually depend on alcohol and drugs to sleep, or to cope with stress, or to cope with boredom, or to elevate their mood because they are so worried, or because they are so sad, or they are disappointed. So we need to avoid that. Once you take it, once you have the illusion or the impression that things are working, that it helps you, but when if the effect wears out, you come back to that same reality. So it's better you check for right solution, permanent solution, long-lasting solutions for the problem, rather than running away or creating a fake wall, an illusion, if, or an illusion to just shallow the real situation. Yes, so we need to avoid that because this can actually lead to dependence. And we also know the effects of alcohol and drugs on our organs. We are not going to go deep into that. So this is really to discourage. And when the next thing we're going to talk about is making time for leisure. When we talk of leisure, we think of joy, happiness, enjoyment, relaxation. So all these words have just named are just positive, positive, positive words. So we need to make time for leisure. Now, making time for, when we talk of making time for leisure, is not only living, going to the beach where you're going to meet many people, going to the bar where you're going to be exposed. For remember we said with COVID, we need to adapt new routines. We need to change the way we used to do things. We need to create new things. Yes, as when we are talking of leisure, you can also try new things. If you try it doesn't work, you drop it. You try something new, you'll be happy. It will boost up your self-esteem that at least you did something new. And on the image, you see a child playing with a father at home, and they are not out, they are not exposing themselves, but they are having leisure. You can know how to create leisure in your own environment. Mm, what is happening? So, and another thing we need to do is we need to connect with our loved ones. I think Dr. Brunhilda in her presentation told us the mentioned the effects of loneliness on our mental health. She mentioned depression, she mentioned suicide. So connecting with our loved ones can actually, in fact, it's not like it can, it's actually very helpful. Some people, when they are alone, if may develop many mental health issues, and some may even lead up to suicide just because they did not have the opportunity to share with someone. They did not have the opportunity to know that somebody care about them. They did not have the opportunity to see somebody smile or to smile with somebody. Now we need to adapt the way we do things. Are you still going to be taking your flight to go to the other city to meet your family member, or take public transport, expose yourself? Now you really need to think. COVID is there, and COVID has just changed the world. On the image, as we are seeing, that's a family. You say, I want to believe that they are having a video call, and the child is apparently recognizing somebody she knows. That's one of the ways we can use to connect with our loved ones. Yes, that's just one of the ways, because somebody will ask her in our villages in Buddha, those mothers there, do they know how to use video calls? Do they have Android phones? Yes, we're going to think of other ways how to connect with loved ones. Even with simple calls, we can always do that. Mommy, how are you doing today? Is actually very helpful. Ask them how they are feeling, how they are coping with the situation. And with and now I think we also discussed about the effects of COVID in children. Now, how do you handle the children? What you have to do is to explain COVID in very basic, gentle, nice way to the children, and you even model it. You show them the example. Yes, that's what you need to do for the children. Don't think that they are children, when they will be big, they will understand. No, they are understanding, they're equally having doubts, and they have the right to the information. And you need to bring the information to the way, in a way that they will digest it, they will understand it very easy. You will see on the image, the mother is, I'm sure after explaining, now she's modeling. That's just one of the things we can do. And we should also be examples to the children. We should know that each thing we do, everything we do, the children will always see and copy. And we should have this habit to share with people. Even if we may not share with everyone, but at least you can talk to people you trust about your concern and how you are feeling. It is helping. It can help. So do not really keep it to yourself when it is just so full in you. Share with somebody. Even the person might not give you the solution, but in the course of talking with somebody, in fact, in the course of talking, you also reflect on the problem, and the solution might even still come from your own self. And you need to protect yourself and be supportive to others. You need to protect yourself against the pandemics. You need to protect your mental health. It is very important. You need to be supportive to others. So I have a question for us. What are you doing to protect yourself? What have you been doing to protect yourself? We are going towards the end of this presentation. What new thing have you learned that you can do to protect yourself, to protect your mental health? And now, have you been supportive to others? What have you been doing to support others? Is it by stigmatizing those who are out of quarantine? Is it by stigmatizing those who are suspected cases of COVID-19? Is it by stigmatizing the confirmed cases? Is it by stigmatizing them? I don't know, I'm just asking. So try to reflect, what have you been doing? We are not asking you to go and embrace somebody to show that, my brother, I'm with you. This is no longer the era at which you go and embrace somebody, you go and hug, you go and tap. In fact, before you even tap the person at the back, you need to go closer than 1 meter. I don't think that's what we are encouraging people to do now. We should be empathetic. We should be supportive to others. You can always call, how are you coping? How are you? Know that you are not alone. Do not hesitate to call us and let us know if we can be helpful in one way or another. There are always things you can do. Even the call, just telling the person that you are with them, it is enough. But not going to tell people that, that person is in quarantine. When he comes back, make sure you run. No, the illness is there, or the illness is around the house. So that's not it. And through this presentation, we are trying to build you up, to build up your mental health, teach you how you can take better care of your mental health. Now, after everything, you may still feel so overwhelmed to an extent that COVID is affecting your ability to care for yourself and care for your others. Do not hesitate to ask for help. You may need a consultation from an expert. You may need just something more than just this presentation. Now, it's very unfortunate that very little or nothing is being done about taking care or handling mental health issues in relation to COVID. The little which is being done is just is focused towards maybe the counseling of the positive cases. Meanwhile, everybody is affected in one way or another. So I don't know what is obtainable in your countries. Maybe during the question and answer session, we're going to discuss, you may share with us what they do in your own country. But I want to believe that in every country, at least there is a toll-free number you can call to inquire what can be done, to express your concern, and at least they will orientate you, they will direct you to where you can get care. So, what I did not say at the beginning is that I'm equally the president and founder of this association, Healthy Brain Cameroon, and we are offering remotes. We provide remote psychological first aid and psychological support. I've come to the end of my presentation. Thank you.
Thank you very much, Tiffany, for that presentation. It was actually very informative on my part. For those who are just joining us, this is the workshop for COVID-19 and mental health. And it's been a brief session. It's been a long presentation. We actually hope that it will take 45 minutes, but we started a few minutes late. So we've actually taken 45 minutes, but we are up to an hour. So we move now to the question and answer session. The question and answer session, we are going to, first of all, we're going to look at the chat. We have some questions already in the chat. And if you are here and you wish to ask a question, you look at the control panel of the Zoom, you will see an option there to raise your hand. Now, if you select that option, we're going to see that you have a question to ask, and we are going to actually tend to your question in due time. So that's just how we are going to proceed during this session. So the very first question that we have here is asked by Sir Flavius. He's asking what are the diagnostic methods, or what is the diagnostic test for identifying COVID-19. I'm going to take that question. Simply, what we need to note is that COVID-19, like we said, is a viral disease, and it is being identified ideally by using what we call the PCR. The PCR is a genetic test that identifies the genetic material in the virus itself. If those of us who started the presentation, you must have noted at the start of the presentation that we said that the virus is caused by a coronavirus, and coronavirus, it's a virus that contains a genetic material that is encoded by viral particles, which are in a crown-like format. So it's identified by what we call a PCR test, which identifies actually that genetic code of the virus. So I want to go down to the slide where we had that. So this is where we were, and we see that this is what the PCR test does. It picks out this RNA in it. Now, the other means of diagnosis is what we do in rapid diagnostic tests. It's a antibodies to the coronavirus. Now, persons that test positive for the coronavirus antibody test will actually be taken further to do the PCR for confirmation before they are isolated into a treatment center if they're actually having severe symptoms. So that's it. Those are the two diagnostic measures that we use as of date to identify to tag somebody that the person has COVID-19. There are a battery of investigations we do as health professionals to be able to further confirm if this person has the disease. But baseline is a PCR or an antibody test. Presently, the mass campaign in some countries where they're testing everybody, they actually do the antibody test, and then those who are actually positive, they get them now to care and treatment centers where they run the PCR. So I hope that question has been properly answered. So Flavius, if you have any other worries about this particular question, they are welcomed. So in the chat, we also had a question that is asking for what diet is recommended for persons living with COVID-19. I don't know if any of the panelists want to take that before I do. Dr. Brunhilda, Ms. Epiphany, are you there?
Yes, from here, I would like to talk about the particular diet. Actually, there is no particular diet recommended for COVID-19 patients. Now, based on all the information we have read or we have heard from the presentation, we believe that for you to stay safe, it means your immune system has to be strong. And as such, your diet, you have to eat a well-balanced diet which will improve your immune system. A well-balanced diet, by this I mean you eat fresh foods and not on processed foods or canned foods. You eat fruits and vegetables, eat a lot of fruits, avoid to overcook the vegetables, because once you overcook them, they lose the vitamins you could get from them. Drink enough water, because water is very hydrating your system, is very therapeutic. And the recommendations is usually 8 to 10 cups. That should be about 2 to 3 or I don't know exactly, but a cup is 250 mils. So you can do the maths. Eat moderate amounts of food, fat and oil. Avoid all the pizzas. I know that now we are home, we want to spoil ourselves with some burger and pizza, but all of that does not help our system much. Eat less salt. We can limit our salt to a teaspoon of salt in our food. Limit the quantity of sugar you take. You can choose fresh fruits over sweet snacks like chocolate or cakes or cookies. And also to avoid eating out, because the people who prepare those meals, they're not going to use those measures that you use in your houses. So when it comes to diet, I feel that this is what we can practice when it can when in order to boost our immune system. I hope that answers your question, Mr. Flavis.
For that.
Yeah, sure. Sure, perfect.
Okay. Okay. All right. We have Mr. Flavis. Mr. Flavis, do you have any other questions? Since we've attended to 2 of your questions, I think you might want to verbally voice any other questions so that we tend to them.
I think I have the last question, which is in the if there are any possible candidate drugs.
All right. Okay. I will take that question. So presently we have what we call the Solidarity Trial. After this presentation, you can Google that and read about it. Now, the Solidarity Trial is a trial which has been started by the World Health Organization since January, that is taking a pool of what we call randomized control clinical trials from all across the globe. So because we need a cure, a vaccine, and a treatment as soon as possible, it's impossible for us to do that if we have to do it in just one country, because we'll need at least 5 to 6 or even 7 years to do that. So the trial has given us the opportunity to have a drug possibly in the next 12 months. So what is the trial all about? It's testing all persons who are COVID-19 from across the country who are in these COVID centers on what we call trial drugs. Now, what are these trial drugs? That are actually approximately 6 in number. The very first and top in line is a drug that is used presently to treat patients who have HIV. It's an HIV drug, lopiritonavir, that's the name. So that's the first drug that is being tested in trial, and presently it's not yet conclusive. That's why we'll still tell that there's no cure for the disease. Secondly, the second test drug that we had that has been withdrawn was the hydrochloroquine that was being tested, but it actually had a lot of side effects on participants who took them, and it was actually withdrawn from trial. Some countries are still using the hydrochloroquine for trials, but it's not still part of the solidarity trial that is being taken up. Second, we have a very interesting ideology, which is what we call a convalescent serum. Persons that have recovered from COVID-19, we have their serum that is being extracted and purified, so much so that if it can be formulated or synthesized into drug molecules, that is actually one of the most promising hypotheses in the solidarity trial, that we hope that if we could get someone who has developed antibodies against it, has survived this, if we could mimic the antibody nature in the form of a drug and then do that, how will it do? So the drugs that have been modified as antibodies are actually being tested as well. Now, the fourth option, it's also another set of drugs that are being used also to treat persons who are HIV positive. So it's also being used in the trial. And the last is an antibiotic that we've known from time immemorial, azithromycin, that is also being included in the trial. So there are actually 6 classes of drugs that are being tested in the solidarity trial. And that is like I'll tell you, it's the most legit scientific backed trial that each on a daily basis, I for one, I read about its progress and its evolution. Now, part of the solidarity trial that was added in the UK was the use of dexamethasone, and they had their findings last week, and they could say that persons who were on oxygen, on oxygen in the ICU, actually 4 out of 10 of them, that's 25% of persons who received dexamethasone, actually had better outcomes. So they stayed shorter in the intensive care unit. So that is why presently they recommend dexamethasone for persons who are in ICU, but we do not recommend it to persons to take it over the counter as drug. Let's not misquote what I'm saying. So those are the classes of medications that are on trial, but we'll still emphasize we need to give time to science to get us the final molecule that we'll use to actually treat this viral infection that is plaguing the world. I don't know if I've answered your question, Mr. Flavis.
Yeah, sure, perfect. Thank you. I'm satisfied.
Sir, the chats again. We have a question here which says, what do we classify as drugs to reduce the pandemic? Do we mean is this based on addictions? This is asked by Miss or Mrs. Artenis. I don't know if you're online. You could just help us clarify what you meant on this question so that we can attend to your question.
Yeah, hi everyone. The third speaker mentioned that you need to avoid alcohol and drugs. Sorry, I'm not sure what her name is. My question on the drugs bit is, well, we all know that drugs is probably medication, but on the other side of it, we've got drugs such as cocaine, weed, things that people take as an addiction or as a stress relief. So my question was, what do we class as drugs? Is it the normal medication that we take for health problems, or is it the addictions?
All right, thanks for that clarification. Miss Epiphany, are you there? I think you can best pick up. But I think she was referring to addictions, drugs, that addictive drugs, illicit drugs in particular. Because alcohol in itself, it's addictive, and so on that slide we just elaborated on the fact that we should avoid substances that will prone us to addiction, because it will only worsen the psychological experience from the pandemic, because person will want to cope using these illicit drugs and these other methods, but we are advising on these other healthy means that we can help to improve on our experience during the pandemic. Ms. Epiphany, I don't know if you can throw more light to what I've just said, if I omitted some things. All right, we have another question in the chat, which says, is there immunity to COVID-19 if you've had it before? Okay, that's a very brilliant question. Yeah, some person thinks that once they have the COVID-19, they can't have it again. Now, I will tell you that as of date, we can't say 100% that you have immunity for COVID-19. Now, looking at extrapolations from other coronaviruses that we elaborated, the MERS and the SARS, which have passed, we know that, and with other respiratory diseases like the common cold that we have, immunity wanes. It wanes. Okay, it wanes. So after some time, you lose that residual immunity, and then you might get infected again. It's very possible. So just like every other airway infection, you can get reinfected. But the difference with somebody who is having a primo infection, that means you're infected for the very first time, it's that somebody who has been infected has been sensitized, their immune system has been sensitized, and so the immune system will react in a stronger way than somebody who is having this infection for the very first time. So yes, the severity of disease in somebody who has had the disease before would be less severe compared to someone who is having a primo infection. So what we want to add is that as of date, it is not yet clear if we have 100 long-lasting life immunity from being infected with COVID-19. But we are extrapolating from other viral diseases that having been infected with COVID-19, you would lose your immunity with time. That's what I say. It wanes. You lose your immunity with time, and then you can get reinfected, but it's going to be less severe than somebody who has never been infected. This question comes from Mrs. Agbonyensi. I don't know if this is clear enough. If you have any worries, you can also elaborate on that. We haven't noted any hands lifted up. We have so many of us on the panel, and it would be interesting if we could have one or two questions from those of us who have been from the very start. So great. Ms. Athenis has her hand up. You have the mic. You can unmute your mic and ask your question, please.
Yeah, earlier on you mentioned that an infected person sneezing can make the infection last in the area for the next 6 hours. So is this just the scientific research, or has it been medically proven? Because I mean, 6 hours is a long time, and
yeah,
it's a bit questionable.
Yeah, from current studies, from what has been proven, it's that yes, a virus can last in the air droplets for up to 6 hours, and on other surfaces for longer periods of time. It's just that I don't have the details, and that was a nice slide that would have included. But yeah, it varies from everybody. In air, in particular, because it's the means where it has been started propagating, it can last for up to that duration, up to 6 hours, and so that's why the campaign is to wear face masks, to stay at home. If you stay home, wear face masks, wash your hands as much as possible. That's actually the campaign. I don't know if any of the panelists will have anything to add to that. All right, Mr. Tennis, I don't know if you're satisfied with the answer.
Yeah, that's fine.
Sorry, I'm back. I had a problem with my laptop.
All right, you're welcome back, Ms. Epiphany. So there was a question here that needed your attention, which was simply that when you say we should not get to alcohol and drugs, were you referring to drugs as in drugs used for addiction or for medicalized drugs?
For addiction. And then some of these drugs we use for medical purposes can also be misused. I'm not going to name them here, but some of these drugs, you can actually use them for medical conditions, but other people use them for other negative purposes.
Right.
And I want to believe at that time
Right.
we're also
Thank you
talking
for
about
that.
sleep, so nobody should depend on drugs to cope with stress or to get sleep. Depend on drugs to have good sleep.
All right.
Mm-hmm.
Okay, we are hoping to end the session by 19:30. That's GMT +1 in Cameroon. So if there are other questions, we've exhausted all the questions in the chats. If there are other questions, please feel free to lift up your hand from the presentation. If there's something you think that we need to add in subsequent outreach with respect to COVID-19 and other health conditions, you can also share with us so that we try. We are actually hoping to build a community of Africans who promote health in Africa. So your questions are all welcomed.
And
We
it
have a
must not be
question
question.
from,
Even
we have a question.
contributions, we can equally have experts in the forum. They can equally share with us. It must not be questions.
Exactly. We actually should have some health experts on the forum, and yeah, we'll be happy to have you share with us your experience in the front line and some advice for the audience who are not health experts. Dr. Bonhida, you were saying something.
Yeah, I was saying we have a question from Rich. He says, as healthcare providers, how do you protect yourselves at work? Do you have adequate personal protective equipment? Now, this question, I would say, is it depends on where you find yourself, first of all. It depends on whether you work with the public or with the private sector. I'm talking in the case of Cameroon. Now, from a private health sector perspective, at work, we protect ourselves mostly with face mask and the face shield. Now, in case we come in contact with patients, or if there are patients where whom, as they come into the hospital, they are first of all screened before even coming for consultation. Now, if you have a patient who is suspected already, there is a special consultation room for those patients where you protect yourself with the gowns and the face shields and the cap and the boots before attending to those patients. Talking about having adequate personal protective equipment, we have what I would not say we don't have enough. I don't want to expose our system, but I'm sure that we have what we have to attend to the patients that come to us. Mhm.
Yeah, thank you. That's a very interesting question. But what I would say is that the healthcare system still needs a lot of support from everybody, be it in form of protective equipment and so on and so forth. We have what we have, but it will not be adequate if Africa actually has the kind of outblown pandemic we saw in Italy, the US, and the UK. So
Exactly.
yes, there's still a lot that has to be done, but we are coping with the means we have and doing our best to be protected and also to serve the African population.
There is another question from Miss Agbonyensi, which says, how long can viral particles stay in an individual who tested positive? I think Dr. Sintieh can better handle this question.
All right. Thank you for giving me the floor. Well, it's the infect you are infectious for. First of all, we talk about you being infectious. You're infectious from the third day of infection right up to the 10th day of infection. After that, your infectivity wanes. It wanes right up to 21 days. After 21 days, you are likely not infectious from what a very detailed study in China proved. So that's it. The infectivity is actually peaking at the fourth day of infection, and most persons don't even manifest symptoms when they are infected at the fourth day of infection. This was actually identified in a group of asymptomatic patients. So it's actually important that we really take care of these barrier measures. So yes, you can be infected right up to 21 days being infected. That is why they'll tell you you have a quarantine period of 14 days at the time that they pick you up, because you don't know when you picked up the symptoms, because at least we know that after 14 days of being of being infected, your infectivity wanes down. You become less infective, and it actually clears off right up to 21 days. So that's it. That's it. I don't know if Miss Nancy is cleared with that question.
Not quite.
Oh, did I hear not quite?
Not quite.
Yes, not quite. Okay, you just want to just know that you can be infectious up to 21 days. Let's just use the 21 days for period. You can be infectious up to 21 days, but you are most infective between the third and the 10th day of infection.
And
Is it
after that,
okay?
will you still test positive? Will your results show positive, or will it become negative?
You will have a negative test after 21 days. That's
Because
why you have a repeat test once you because they repeat you have to before they test somebody that is say you are healed. You have a test that is done twice a week apart to be confirmed that you're cured from the disease. The two tests after your quarantine of 14 days have to be negative for us to be sure that you are no longer infectious. And so yes, you test negative after 21 days.
because I know of somebody who was tested positive in April and in May still positive, this June still positive. But
What kind?
she has no
Yeah,
symptoms.
she has no
She has
symptoms.
she has no symptoms anymore.
All right. So is it the antibody test that is being done, or is it the PCR that is being done?
The PCR.
Okay. So definitely we just need to double check on that. There are actually rare cases, there are actually outliers from the studies from what is always reported in medical literature. So yeah, but if the person doesn't have symptoms, is testing positive, it's scary. It's actually going to be demoralizing mentally. So yeah, but that person needs to be counseled a lot, and if he or she is following care, it's always good that they get the most adequate if they have no symptoms. Well, I can't really say for certain. It's a new disease. We can't say 100% everything. All what we are saying here is what we have from borrowed studies in Europe and the rest. We are hoping that we'll start ours in Cameroon very soon so that we'll have our own facts.
Okay, thank you.
You're most welcome. So I have an interesting question here, which says that is there any particular reason why babies are not are hardly infected or don't have severe COVID-19 infection? That's a very interesting question, I must say. And the second part of the question says, are preventive measures important for babies, and how do we go about it? All right, Dr. Boyna, do you want to take that? We didn't get you. Your mic was muted.
I'm not too sure I will give the right answer to that question.
Well, anyway, from what we've read, children are affected. That is why there are even literatures of mother-to-child transmission of the disease right now. But children are less talked about because maybe focus is not being made in that domain of persons. But yeah, I think if we had a pediatrician on board, he or she would have had a lot to tell you about the children's species that are there. But I think it's a homework for us to actually dig deep into what is happening with the children population. Generally, preventive measures for children, yeah, we have marks adapted for the pediatric age, but for the newborns, they need to be kept very, very, very uh, apart from the adult population. So if you have a newborn in your home, the baby's cot should be really, really restricted from the general population, and we should practice strict hand hygiene so much before getting a baby fed and so on and so forth. We actually do that in our maternities here to be sure that our babies don't get infected. We limit the number of visitors that come to see the babies, the newborns, and so on and so forth. So I think Mr. Ojong, yes, he's a person who's asked the question. If you're okay with that, you can just say yes. But if there's any person in the panel that can throw more light, we will be happy. So we have approximately 10 minutes to round up with our presentation. Presently, we are counting 10 participants. We started with over 30, so we have 10 participants left standing. So we'll be rounding up in 10 minutes. So any additions, any questions, anything we'll have, we'll want to welcome them.
I'm surprised nobody is talking about mental health. No comments about the mental health. We are always concerned about the preventive measures, the cure, but the focus of this presentation was more on how to take care of our mental health. If there are no questions, at least then we can share what we've learned so far. How can we better take care of our mental health?
From the presentation about mental health, how to cope mentally with the virus, I think what you said was quite important, like exercises, keeping in touch with our loved ones, eating. That's that's quite important to help us mentally, because I mean exercising and keeping in touch with people reduces a lot of thinking, especially for people that live on their own, have no one to talk to or have no one to physically see and discuss with. Yeah.
Thank you. Thank you. Thank you. I'm sure as you're repeating, those who missed it are also getting it. Thank you. Any other person to share one or two things with us? And I hope we're also able to identify some of the mental health issues we are already having as a result of COVID-19 from Dr. Bronhida's presentation.
Yeah.
If not, I hope the information will help us in the future, or it may also help others around us.
All
As Dr.
right.
Sintieh, over to you.
Thank you very much, Ms. Epiphany. We are exactly 5 minutes to 7:40 p.m. We thank everybody who has made it right up to the end. We thank everybody who has made it right up to the end. We hope that we will also share the link in the WhatsApp forum for everyone to be able to rewatch the presentations and also keep it with you. So thank you all for tuning in. We have another session tomorrow for persons who will be available tomorrow. If you think that you benefited from the presentation, feel free to share the links that have been shared on the WhatsApp group. And at the end of this presentation, all those who registered for it will receive an email inviting them to answer the post survey. It's just a way for us to see how well you've been impacted with the presentation, and if you were affected, for those who filled the initial survey, how well you are coming out of it. So I thank you, Mr. Rene Eta, Mr. Tui Ojong, Ms. Athenis, and we thank Miss Ruth and Mr. Ngwembang for making it right up to the end. You are wonderful, and together let's stay safe and hope to see you people physically at the end of the pandemic. I will give the floor to uh, Dr. Brunhilda to talk, and then Dr. Epiphany is going to round up. And if you have any words for us, you're going to share it after the talk so that we round up.
I want to say thank you to all of you who have stayed till the end of the presentation. We hope that the presentations you have learned at least a thing or two, which will help you, will help your family, will help your community as a whole. If your chance tomorrow, you can still join us for the other session of the presentation. It's going to be the same presentation anyways, but nothing hurts learning something over and over and over again. So thank you very much for your time. God bless.
Yeah, if you've ever experienced any form of fear because of COVID-19, it's not a sign of weakness. But if this fear have started affecting your functioning, then there is a problem and you need help. Please seek for help. Thank you.
Okay, thank you very much. Thank you very much. Thank you very much, Miss Epiphany. I don't know, Mr. Rene, are you there? Anybody, Mr. Gwembang, are you there? Miss Ruth, Miss Agwo, you can just say some last words for us and we close. All right. So we trust that network is failing for some persons. We hope to see you people soon in the future in other presentations. And you all should stay safe, stay at home, practice the safety measures, and God bless you. We will all make it through 2020.
Amen.
Amen.
Bye bye.
Bye.
Bye, bye, bye,
It
bye.
was nice.